Hey, I'm your host, Dr. Desiree Cassell. I'm an orthopedic and pelvic floor physical therapist specializing in women's health, aka pelvic floor. I'm a wife, mom of 3, foodie, lover of all things movement and nature, and I'm super passionate about educating, empowering, and supporting other women like you to find and maintain balance throughout all aspects of their lives, without pain, pressure, or peeing their pants. And this is the Balanced Momtality Podcast, where we will talk about all things pelvic floor, your core, and optimizing your pregnancy, birth, and postpartum recovery, providing you with the knowledge and tools so that you can feel like the strong, playful, and happy mom that you and your family deserve. Now let's get you out of those pads and back to loving movement. Fill up your water, pop in those AirPods, roll out your mat, and let's connect. Before we start today's episode, just a quick disclaimer that anything mentioned in this podcast is not meant to treat or diagnose any medical conditions. If you have any questions or concerns about your healthcare needs, please seek the care of your medical provider. This is also a safe space where we will be talking about very sensitive but important topics, such as issues with peeing and pooping, relationships, and even sex. So if you have littles around, probably a good idea to pop those AirPods in. But otherwise, I hope you enjoyed today's episode. Hey girl, I'm so happy to have you here on the show today. Because we are already well into February, which is just crazy, I thought it would be fun to add a little series this month talking about pain with intercourse, dyspareunia, and or pain with pleasure or any kind of dysfunction around intimacy. With Valentine's Day this month, it can bring up a lot of feels. There's a lot of pressure to perform, to be there for your partner in ways that maybe you don't really feel comfortable, or maybe they're actually physically painful and uncomfortable for you. And with that being said, I want to help take away some of that pressure, but also give you some hope, some tools, some clarity, because I know that these topics and these conditions and situations are so complex and can be very frustrating. I have had way too many women come into my office working with me virtually, whatever it is, with very similar and heartbreaking stories of not being heard by their providers, getting written off, even being told things like, just drink a glass of wine beforehand and chill out, which is just so like 1800s. Like, why are we still just writing off women's discomfort and pain? And men, hello, if your partner is having pain, I really hope that you're not pressuring them to still go through situations just for your pleasure, because that is going to make it worse. It's not going to help their system. It's going to respond like a trauma, and it's going to make healing even harder. So I thought this episode and the first of this series, we would just dive into what pain with intimacy is and what some common causes of it are. And we'll tap in a little bit to what we can do about it, but that's really what the rest of the series is for. We're going to dive into the mental frustration and overload that can happen here, the tips and tricks to help improve pleasure and reduce pain, and help to bring it full circle. So stay tuned through the month of February. We will be doing one episode a week in this series. So I hope that you are staying tuned and help spread the word to anyone you know would benefit, because again, this is such a taboo topic. Many people aren't bringing this up, and if they have, they might have gotten written off or sent to another provider who does testing and sends them to another provider, and they're just feeling so frustrated. So this is here to give you hope. So let's dive right in. The first thing I want you to understand is you are not alone. This is a lot more common than people realize. And part of that is just because we're not talking about it, right? So then you have people like me who feels this responsibility to come on this mic, preach to the world that pain with sex is never normal. And again, I've heard this too many times with patients, even being told that by their provider, especially after menopause or some of these hormonal shifts. I've had women literally be told by their provider that they trust, oh, after menopause or in your 40s, that becomes normal. It's just part of life now. And what does that do? That puts a lot of frustration and hopelessness onto these people that are suffering and making them feel like there's nothing out there to help them and that this is just part of their life that they have to accept now. And that is just so depressing because it can still be a beautiful and pleasurable experience throughout your life, no matter what stage you're at. So with that being said, you are not broken and you are not alone. So today we're diving into the pain part. What is it, why it's happening, and what your body might be trying to say. And it is crazy, but up to 1 in 5 women will experience pain with intercourse at some point in their lives. So maybe you're someone who doesn't have pain all the time, right? Or you're like, oh, it's just a little bit at the opening, or oh, it's just in this position, right? Like the more I dive in, people are like, oh, no, I'm fine. And then we dive in and they're like, oh, well, actually, we haven't done doggy style in years. Or maybe you even want to try anal penetration and you have pain there and there's no way you want to attempt it because it hurts, but you want to. These are goals that we can reach, but we really need to silence the shame and bring this topic into the public eye and really help you guys see what the truth is behind this, because it can feel like a lot of different things and it shouldn't feel like any pain. It should all be comfortable and pleasurable. I will say the only time where I'm like, oh, okay, no big deal, is if we haven't had sex or any penetrative intercourse in a long time and you have it and it's a little irritated, feels a little stretched at the opening, but then as you get going, things are comfortable, no more pain, and you can ease into it. That's pretty expected, right? But if you're like, no, we have sex regularly and that introitus, that opening of the vagina hurts every time, feels like it's tearing, so uncomfortable, or no, it's always uncomfortable in this certain position, or oh yeah, maybe it's cyclical. Sometimes it hurts, sometimes it doesn't. I also frequently hear it feels like he's hitting my cervix. And sometimes that can be true, especially if we have things like prolapse. But a lot of times it's not even the cervix, it's actually the pelvic floor that they're hitting, and they're hitting these trigger points that are really uncomfortable. So some other examples of what this might feel like is burning. So if you have any burning at the opening or deep, or sharp pain at the entry, or even cramping during building into orgasm or after, right? This heavy ache, this heavy cramp, and it can feel like a menstrual cramp, but even feeling blocked or like it is hitting something. Or maybe that superficially around the vulva and clitoris, it's really sensitive and tender. And we have more of what we call vestibulodynia or vulvodynia, where we're having actual more external pain around our clitoris and our vulva and labia. And this isn't just a tight pelvic floor, right? But I will say there is always tightness. So yes, when I get referrals from providers, when a patient is having pain with intercourse and it says Kegels, I just laugh, because to me, it's like, wow, they really, really don't get it. So if you are expressing to your provider that you do have pain and they're telling you to strengthen your pelvic floor and or do Kegels, which is right, like we can strengthen with those, it can make things worse, which is why I'm a huge advocate of not just doing Kegels, because when we have pain, even if something is weak, right, it will lock up and guard because it is feeling pain. So it's trying to protect you. And that tension and pain ends up creating a reduced circulation and blood flow, which creates more tension and more sensitivity to the nervous system. But it is often multifactorial. So there are physical causes and emotional and nervous system contributors. So I want to dive into those here. So the physical causes, this is again, the very first big obvious one that I just mentioned is pelvic floor tension or overactivity or hypertonicity. So this is when your pelvic floor is just chronically tight, whether you're clenching it on purpose or most people have no awareness that they're actually just clenching their pelvic floor all the time. And that it restricts the blood flow and it can cramp up around the fascia that's supposed to move and the tissue that's supposed to move around the clitoris and to help promote that blood flow and pump to create a true and pleasurable orgasm. But then we can also have scar tissue from tearing or C-section or any kind of abdominal or pelvic surgery or even back surgery. These scars really need to be worked on, and most people are not being told that they are supposed to touch their scars and mobilize their scars once they hit the 6-week mark. So be your own best advocate. Start looking into scar massage. Work with me. Reach out to me. I'll teach you and show you how to do it. And yes, we do this virtually all the time because it's crucial, because those scars create anchors and tethers in the system that then restricts, again, the movement and mobility and blood flow that's supposed to normally be there. But then we can also have like physical dryness from postpartum, breastfeeding, perimenopause. Those hormonal changes can really change the sensitivity of your tissues. And we can't forget about that. So this is where things like topical estrogen cream are a game changer, because that body is missing the estrogen that helps pump up and lubricate and desensitize the tissues right there. And so topical estrogen is super safe. This is one of the forms of estrogen that stays very local to the tissues. It doesn't impact your general systemic levels of estrogen in your body. And there is a huge push right now in women's health to accept these forms of estrogen and stop being so fearful and afraid of estrogen therapy, because the link that was caused with cancer and all of that was this crazy study that was only looking at one form of estrogen, and it had a couple bad outcomes, obviously, like cancer. So it created this huge scare. But we've had so much research done since then, and we just had the black box warning removed from estrogen, which is so exciting because it does help take away that fear for some of these treatments that can be game changers. I have had topical estrogen be the thing that as soon as they start using it, it can take away that sensitivity and pain, and even leaking, especially if we're getting leaking because of urethral atrophy and or weakness. That estrogen helps plump up that urethra and create full closure. So if you are postpartum, breastfeeding, going through perimenopause or menopause where we have a loss of estrogen, topical estrogen is amazing. Reach out to your provider, ask them to give it a shot. It is super, super helpful. But other physical causes could be prolapse or anatomical changes. So as I mentioned before, if we have a uterus that's dropping down or a bladder that's falling into the vaginal canal and they're getting hit on penetration, it can cause pain. So we need to help restore those organs and help provide you with positions that will put your body in a scenario where that organ is not being hit. Because once we have pain, the body tightens. So if we can create intimacy and pleasure in positions where we don't feel that, the body starts to relax and help rewire that reaction and response around intimacy. So we do want to make sure that we are monitoring our pressure management, constipation, all the things that we do want to look at with prolapse. But another physical thing is nerve irritation or trauma. So if we've had any trauma to the pelvic girdle, physical trauma, we're talking about that in this scenario. But in the next section here in a minute about emotional and nervous system contributors, that emotional trauma is also huge. So we do want to just think of trauma in general, because if there is trauma to the body, especially if it was a sexual assault or even birth, can be pretty traumatic, or maybe it's even an abusive relationship, or you just have had a weird story around your body and around that space and around intimacy, and then you had pain with that first experience. So your body just started to write this story that pain sucks. And so every time you're in that space, your body tries to protect you by giving you pain. But nerve irritation coming from impingements up through the pelvic floor, the glutes, the low back, vertebrae in the spine can create extra sensitive spaces in that pelvic floor area. So this is why we don't just want to treat internal pelvic floor. We want to look at the low back. We want to look at the hips, the glutes, the core, even the upper spine, to make sure that we're not getting nerve impingement or restrictions that are going to create extra sensitivity and impairments down the line. But moving into emotional and nervous system contributors, this is where I do just want to start with the reality that your pelvic floor is so ingrained into the autonomic nervous system. And so especially if we've had any trauma, past trauma, sexual trauma, birth-related trauma, as I mentioned, or any kind of even just stress, your pelvic floor really holds that story. And if you're not aware, your body does hold the score. It keeps memory. Your muscle holds memory. Fascia holds memory. And we're really learning a lot more about how the fascial system is what is here to hold and receive and protect and guard or release and soften and create movement and freedom through your body. And if your fascia has had this story or experience that really traumatized it, it's going to lock up and create this nervous system response that creates more sensitivity and pain around those situations. So we really have to look at the mental health aspect here. This is where a sex therapist can really come into hand, but I also feel like I'm like 50% a mental health therapist with all my patients because we can't ignore that part. Stress and just chronic tension are held in the pelvis. So even if you're feeling like high anxiety that day or you're having TMJ flare because you're clenching and guarding all day, we can pretty much guarantee your pelvic floor is also guarding and holding that tension. So that mental load does create a disconnection from your body. And this is why the breath work and simple awareness of how you're holding your body is crucial. Because if you can check in and scan your body and release that tension frequently throughout the day, we can start to rewire that nervous system. Because a lack of safety or pressure to perform or unresolved resentment in your relationships can also impact this. It might not even be physical. I've had a few patients where we did all the physical work. They did have tightness. They had sensitivity. They had some alignment things. We worked on all of that. We worked on soft tissue at the opening. We did dilators. We even used some vibrators. Like we had all the tools. We were talking mental stuff. And this few patients that I'm thinking of, they were getting better just very slowly. They were frustrated. They were just like, yeah, I don't know. And every time it came to sex and talking about it, seeing if it's getting better, they're just like, ugh, I don't even want to think about it. Like, yeah, the pain's a little less, but like, I'm not orgasming. There's pain around it. It's just not fun, but we'll keep working at it. And then come to find out, I had one or two of these patients ultimately get divorced. Pain went away. Pain was gone. No more pain at all. Any sexual interaction, self-pleasure, whatever, they were good. And this is just, again, proof that your body is trying to tell you what you're not trying to face. If it's hurting, it might be those boundaries that you're letting get crossed. You're not honoring yourself. You're not standing up for yourself. Or maybe you're just not connecting the way you want to, and you can still repair that. So I'm not saying go get divorced, but it is pretty eye-opening, right? To do all this physical work, see minimal change, a little bit, but not as much as you hoped. Then you end that relationship or repair this problem and the pain goes away. And so this just really emphasizes how much we have to take into account the big picture. And the pelvic floor is a mirror of the nervous system. If you're not safe, you won't soften. So we don't want you to just think that it's a hormone problem or something to push through. And this is where medical gaslighting happens, right? Oh, your labs are fine, or just have a glass of wine and relax. But pain equals a protective response. It's not weakness. So pushing through pain can cause other compensations, avoidance, detachment, and relationship strain. And this is really, really sad because we can address this by starting to help you view your body as not broken, reconnect to the beautiful system and space that it is, help you feel comfortable and give you some tools to start working there, and then help you guys try other forms of intimacy first as well. And so that's what the rest of this series, we will be diving in to ways to troubleshoot, other ways to become intimate, the reality of the mental load here, and so many other things. But I just want you guys to know that awareness and safety are so crucial. Restoration and regulation, so crucial. Reconnection and repatterning, so crucial. So we'll dive into these more and more over these next few episodes, but remember those 3 core phrases: awareness and safety, restoration and regulation, reconnection and repatterning. So amazing. We can really help rewire that system and bring you into a safe space where you can not only have pain-free intercourse, but pleasurable intercourse. So what I want you to do is just start getting some reflection. When did this pain start? Try a short breath work or grounding exercise. And I do have this inside the Pelvic Floor Core and More app, which I do just want to give a little shout out over there, because there is a pain to pleasure masterclass over there for free, where there is a journal, a workbook, prompts inside of there, breathwork exercises. We're really looking at that holistic piece there. So the pain to pleasure framework is inside the Pelvic Floor Core and More app. One side note about the Pelvic Floor Core and More app right now is Apple users and iTunes users. There's an update that's been on the back end for over a week and is being really frustrating and not loading correctly. So you have to access the masterclass and any content via a web browser. So I will make sure that is in the show notes below, but hopefully I don't think the Google members are and Android members are having any issue. But if so, please let me know. But just know that masterclass is over there and that I always do coaching on this. So virtual coaching, in-person coaching, we can really help you start to explore and reconnect with your body and get that more individualized approach, because this can be pretty complex and your history matters. So I just want you to know there are tools out there for you and that your body is not broken. It is trying to communicate with you, okay? But next time, we'll talk about the mental load and the mismatched desire, right? Why you might feel shut down, touched out, or disconnected, even without pain. And pleasure starts with presence, and presence starts with safety. So let's start there, friends. Can't wait to see you here next week on the Pelvic Floor Core and More show. Well, that's it for today's episode. I hope you enjoyed it as much as I did, and I want to thank you so much for taking the time out of your busy day. I know you've got so many other important things going on, but I hope it was helpful and you leave here with some tools to help you in your healing journey. And I just want to ask you, if you have found this helpful, to please leave a review on iTunes. Scroll down to the bottom of my podcast page and leave that 5-star review so it can help other women see this information. And also, if you want to be a part of my community of amazing women trying to balance all the things, great tips and insight and sharing stories and just motivating each other along the way, feel free to join my Facebook group, The Balanced Momtality, Wellness and Support. I hope to see you here next time on the Balanced Momtality Podcast.